Hello, my name is Chloe Cairo, and welcome to my presentation on how I've integrated the AACN essentials into my MSN leadership practice. I will focus on key domains such as population health, patient-centered care, and systems-based practice. This presentation reflects how course outcomes were achieved and how this learning applies to my role in correctional healthcare, as well as my continued professional growth as a nurse leader. In this course, I developed competencies across several different AACN essentials, including population health, patient-centered care, professionalism, system-based practice, interprofessional partnership, and scholarship for nursing practice. These domains guided my learning and were applied through several assignments focused on improving patient outcomes, addressing health disparities, and strengthening leadership within complex healthcare systems. In my assignments, I focused on addressing chronic diseases such as diabetes within the incarcerated population. I explored how health disparities and limited access to care impact outcomes, how preventative care can be challenging in specific settings, and through case studies and population health work, I applied evidence-based strategies to improve chronic disease management and highlight the need for earlier intervention and how important patient education is. This course emphasized the connection between person-centered care and population health. I focus on supporting individual autonomy, improving health literacy, and incorporating prevention strategies. Even within a structured setting like correctional healthcare, empowering patients with education, involving them with their care can lead to better outcomes at both the individual and at the population level. Throughout this course, it was reinforced the importance of diversity, equity, and inclusion when caring for vulnerable populations. I focused on providing ethical, unbiased care while also recognizing that there are unique challenges that many patients face. Advocacy plays a huge role in ensuring patients receive appropriate care and access to services, especially in underserved settings like mine in correctional healthcare. In my current role as a nursing supervisor, interprofessional collaboration and systems thinking are part of my daily practice. I work closely with both custody and healthcare providers to coordinate care and address challenges that come up in real time. Throughout this course, I was able to strengthen that approach by focusing on workflow improvements and leading quality improvement initiatives. This has helped me better identify gaps, improve processes, and support more efficient and effective patient care. In my practice, my plan is to strengthen the population health by focusing on the patient education, starting at intake and during admissions. This includes using those early encounters to address preventative care and reinforce the understanding of chronic diseases such as diabetes or chronic kidney disease and identify the risks sooner. By being more intentional about education and early intervention, I know that I would be able to help patients manage their own health better while in custody and while outside of custody. As I continue to grow in my role, I plan to strengthen my leadership skills through ongoing professional development and continuing to lead quality improvement initiatives. For example, I recently helped develop a process to improve access to Cologuard testing for high-risk patients, which is one way I've been able to apply population health in practice. I also want to become more involved in policies that impact the outcomes and access to care, especially within this setting. Moving forward, I plan to expand my role as a nurse educator with the goal of eventually stepping into a more regional position where I can oversee patient education initiatives and support staff development on a larger scale. This course has strengthened my perspective as a nurse leader and reinforced the importance of approaching care at both the individual and at the population level. It has also challenged me to think more intentionally about how I lead as a nurse, as a coworker, and advocate, and to support both patients and staff in this complex setting. I appreciate the opportunity to reflect on my growth and how I will continue to apply this in learning practice. Thank you. This course has strengthened my perspective as a nurse leader and reinforced the importance of approaching care at both the individual and at the population level. It has also challenged me to think more intentionally about how I lead as a nurse, as a coworker, and advocate, and to support both patients and staff in this complex setting. I appreciate the opportunity to reflect on my growth and how I will continue to apply this in learning practice. Thank you.